My parents told the ER I attempted sewerslide. They don't know the blood samples show that they've been poisoning me. The day my life was saved was when my parents left for their cruise. I ran out the first day they left. Week 1 without medication felt like surfacing from water. My hands were steady for the first time in months. The fog I'd lived in began lifting. Week 2 brought memories disguised as dreams. Jenny, my sister, was 5 years old, getting weaker. My mom said, "The medicine helps, sweetheart." I remembered Jenny's final month, too tired to draw. I called Aunt Eloise. Silence stretched when I asked about Jenny's illness. Your parents cut me off when I questioned the treatment. I decided to snoop and found 3 doctors over 8 months for her. Overlapping benzos that should have been flagged. Behind those, an insurance document. Jenny's life insurance had $200,000 paid out. I checked out my current medication and discovered the doses were dangerous together. Aunt Eloise arrived with Jenny's medical records she'd copied before being cut off. 2 hospitals, both questioning the diagnosis. I documented everything, made copies. My aunt took blood samples to test for current drug levels. My parents returned tanned and relaxed until they saw my empty medication bottles. Mom's face went cold. That night, I caught her checking my pulse while I pretended to sleep. Morning brought crushed pills and orange juice. I saw pieces floating around. I felt like I had no choice but to drink. As my dad stood guard and my mom checked under my tongue. "She's having delusions," Mom told someone on the phone, stopping medication abruptly. They'd been telling relatives I was fragile since college started, building a narrative, emails about my anxiety episodes that were really drug reactions. At dinner, I decided to try and ask them about Jenny, but the moment her name left my lips, they moved fast. Dad restraining, Mom producing a prepared syringe. "She's psychotic," they told police. Stopped critical medication. The ER blood test showed high benzo levels from that morning's juice. They claimed suicide attempt. Showed 8 months of prescriptions. Their lawyer arrived within an hour. There was documentation of my deteriorating mental health. Statements from colleagues about their concern for me. The judge reviewed their medical credentials, my current blood levels. I got a 72-hour psychiatric hold granted for evaluation. As orderlies secured me, Mom leaned close and said, "You should have kept taking your medicine." The intake nurse showed me new prescriptions. "Your parents are so worried. They've been managing your care for months, but they didn't know I had a plan." Aunt Eloise had my blood samples showing dangerous drug combinations no ethical doctor would prescribe. Most importantly, the insurance investigator who'd paid out Jenny's claim had flagged irregularities after we contacted him. I thought about Jenny's final days, how they'd isolated her from outside doctors, how home hospice meant no oversight, how a metabolic disorder diagnosis meant expected death, how 8 months ago they'd started the same process with me. Mom had mentioned during the intake that I'd been declining rapidly despite treatment. She came to me privately and said that sometimes families faced impossible decisions, that my life insurance, $150,000 through their policy, would help with Ethan's education. My baby brother, only 3, the same age Jenny was when she started getting sick. I had to survive 72 hours until the hold expired, until Aunt Eloise could file for review, until Dr. Morrison's report reached the right people. The medication hit my bloodstream. The fog descended. Through the haze, I heard Mom telling the nurse about Ethan's recent anxiety, how he might need assessment soon, how sometimes these conditions ran in families. In 3 days, I'd either be free or transferred to long-term care under their guardianship. Some truths don't fit in one video. The rest, it's waiting for you below.